Good evening, and thank you for joining OSHA Boot Camp webinar. We greatly appreciate your support. My name is Pat Pine, and I'm the owner and trainer for OSHA Training Boot Camp. I provide programs for dental schools, dental teams, and dental groups around the country. This is an educational program, not a sales program. Time was dedicated for research and to provide information as well as ideas. Each review is given to my honest opinion. Tonight for this webinar, you need to have with you your disinfectant label and your MSDS sheet. We're going to be discussing surface disinfectants. And in order to fill out the poll questions and to answer our review, this is very important to have in front of you. You already have the objectives, so I'm going to move forward. I want to thank you again for joining Dissecting Your Disinfectant. You will earn 1 hour of CE when completed the 3 poll questions and the evaluation. So I will be checking for the answers at the end of the program and for your evaluation. I want you to be sure that at the end of the program, when you log out, the evaluation should pop up. So please just be patient. We have over 300 people registered for this webinar tonight. So the computer might just take a few seconds. You will receive your CE via email by the 25th of April. But if you do not hear from me by then, email me because there could have been an email error of some sort. But I will do my best to get them out. This webinar will also be on my website, OSHATrainingBootcamp.com. It's at the bottom there on the left-hand side. And you can view this again or have other dental professionals view it also. I want to thank our terrific sponsors. They really rock. These sponsors care about your health, your practice's safety, and they want their products used correctly for the safety of all. We want to thank Dux Dental for caring about our patients' health and creating a product that is absolutely terrific. It's called Bibbies. And Bibbies replaces our non-disposable bib holders because they're such a source of disease transmission. Think about it. Most of us use our bare hands to place these bib holders around our patient's neck. Then we use a pen to update the health status of our patients. What do we touch next? The cross-contamination continues. When an unsterilized bib chain is placed around your patient's neck, they may be exposed to dangerous pathogens including Pseudomonas, E. coli, Staph aureus, and the most common cause of staph infections and a potential superbug. Saliva, dead skin, neck acne, sweat, hair have all been collected on bib chains and bib holders. I'm sure I would not want anything like this hanging around my neck. Wiping them off doesn't work. They've done studies. And a study was done on disinfecting bib holders, and they were still contaminated. On the lower left area of your screen, you'll see a website. That is for an article that I wrote on bib chains and how contaminated they are. And think about it, going from one patient to the next. We're going to start out with poll number 1. I'm going to go ahead and launch the poll, and we'll give you about 30 seconds and look at the label on your disinfectant. What type of active chemical is being used? A, alcohol, B, quaternary/alcohol, C, phenyl water-based or phenyl alcohol-based, D, accelerated hydrogen peroxide, or E, quaternary ammonium. Okay, I'm going to unlaunch the poll. And we need to move on because every answer will be different. We have a variety of regulatory agencies, and they demand that we use the chemical products according to manufacturer's directions. because they are pesticides. That each product has a safety data sheet that comes with it. If you don't have it, you can get it on the internet. Last weekend, we were all aware of the dental board of the terrible situation in Oklahoma. Having the health department, the CDC, the dental board knocking at your door, it's as bad as the IRS knocking on your door about your taxes. It's very, very stressful. But they will find every little nook and cranny or problem that exists in your office. You do not want that happening. We have a variety of pathogens that we're fighting. Bacterial and viral, they're everywhere. Our goal is to reduce the quantity of bacteria with our surface disinfectants. Although we don't work in a hospital setting, many of our concerns come from the medical setting. Community organisms are a concern for dentistry. These are all bacteria that can affect us and the oral health care professional. We have patients that wrestle. They're in gymnastics. We have patients that are hospitalized. MRSA is contagious, and so are many other pathogens that attach themselves to our patients. We must be conscious of what is going on around us. A completed, thorough health history remains a valuable piece of information. Dentists can no longer pretend that there is only a theoretical problem. Now that the state-of-the-art studies have illuminated dental surface contamination as a potential health risk, dentists must acknowledge the problem, stay abreast of the rapidly evolving standard of care, and do their best to comply with the standard of care in daily practice. If one of your patients becomes ill as a result of exposure to a pathogen or bacteria that is later found on your dental surfaces, you are at risk of being held responsible for your patient's illness and associated compensatory damages. Now, there was an article on patient-to-patient transmission of hepatitis B. Some of you might have heard of this, but back in 2001, a 36-year-old female patient had surgical extractions at an oral surgeon's office in the morning. 60-year-old female patient had surgical extractions in the afternoon. She had no risk factors at all. What had happened is the 60-year-old female, 4 months after she had her extractions, came down with symptoms of hepatitis B. Because she does not have any risk factors such as drug abuse, multiple sex partners, or blood transfusions, they backtracked her actions and discovered she had these surgical extractions 4 months earlier. So, of course, they then looked into the patient in the morning, and they found that with further investigation, that they identified a cross-match of the state health department registry with a 36-year-old woman with a complex medical history and had documented infection with hepatitis B since 1999. So after considerable scrutiny, and they went through the dental office or the oral surgeon's office and checked on their infection control practices, their instrument management, their storage and sterilization, and they found that they adhered to all the standard precautions. The office was found to be well managed, clean, and the equipment up to date and well maintained. But they couldn't discover what was the mechanism of transmission. They never determined that. But they did go on to say that they felt the clinical contact surfaces could be the means of transmission for hepatitis B in this situation. So we want to be aware that hepatitis B virus can live on environmental surfaces for up to 7 days. While we understand the chance of the infection from those surfaces are small, it is possible. Hepatitis B can survive for at least a week in dried blood on environmental surfaces or contaminated instruments. Hepatitis C is spread through contact with the blood of an infected person. This can occur through a small cut on hands, open nail cuticles, or any open wound. The flu, of course, we have a variety of types, and they can be seasonal. If patients' instruments are rusty or porous, that can trap pathogens on those deteriorating surfaces. Trivia here for you tonight. How fast is a sneeze? Do, 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 do. Well, I think you might be surprised. 100 miles per hour. And look at this sneeze. Look at how far forward it goes. It travels about 6 to 9 feet forward at 100 miles per hour. Sneezing can transmit disease. TB is airborne. The flu, colds, upper respiratory, any airborne pathogen. So how do we prevent getting some of these airborne pathogens? Well, we want to cover our sneeze with our sleeve. Sneeze right inside your arm by your elbow, inside the elbow, and this will prevent bacteria from traveling 100 miles per hour. And this breaks the chain of the mode of transmission. How do we get sick? Well, not wearing the correct recommended PPE, which is personal protective equipment, by touching our mouth, our nose, or our eyes after touching a contaminated object, we're for sure likely to acquire a virus. An infected person is most contagious in the first few days after infection, but respiratory viruses may spread for up to a few weeks after the start of an infection. TB is a bacterium that is hard to kill because of its cell wall, which is 60% lipid. This bacterium is aerobe and it needs oxygen to survive. TB is a slow-growing bacterium that divides every 16 to 20 hours, extremely slow compared to other bacterium. So here's a question I received. Since tuberculosis isn't transmitted via contaminated environmental surfaces, why is it important for a disinfectant to be tuberculocidal? Well, many times there can be confusion regarding the claim of tuberculocidal activity for disinfectants. TB is not transmitted via environmental surfaces, but rather by the airborne route. Potency against Mycobacterium tuberculosis has been recognized as a substantial benchmark to measure germicidal potency. There is much more to disinfectants that meets the eye. When looking at a surface and it appears clean, or you ask yourself what disease-happening pathogen could be on this surface, we think, oh, it's not visibly dirty. Have you ever had a bladder infection and shared a urine sample with your doctor's nurse for testing, and they stated they found blood in your urine? You didn't see any blood. Why? Because it's microscopic. On surface, we cannot predict what we'll have on the surfaces, bacteria, viruses, or fungi. Our disinfectants need to be balanced and really read the kill times. Some kill times of bacteria can be 1 minute and 10 minutes on fungi. Keep the surface wet for the longest kill time. Because mycobacteria have the highest intrinsic levels of resistance among the vegetative bacteria, viruses, fungi, any germicide with tuberculocidal claim on the label is considered capable of inactivating a broad spectrum of pathogens. We have a lot of superbugs out there, and here they're in their community, and we need to be aware of them because we certainly don't want them. Here's a list of drug-resistant organisms, and they are bacteria and organisms that have developed a resistance to certain drugs. a particular drug is no longer able to kill or control a specific bacteria or organisms. And this is known as antibiotic resistance, antibacterial resistance, and antimicrobial resistance. The dental community can become exposed to these organisms. Here's a pyramid that illustrates the hierarchy of organisms relative to their resistance to destruction outside the body by disinfection and sterilization. Pyrons are the most difficult to destroy, followed by the spores, which can only be destroyed by sterilization. Intermediate level disinfection inactivates Mycobacterium tuberculosis, which is substantially more resistant to chemical germicides than ordinary vegetative bacteria, fungi, and medium to small viruses. TB is a benchmark organism used to demonstrate the effectiveness of disinfectant against TB. The TB kill time is the contact time needed for a disinfectant to destroy TB. Products or surfaces must remain wet on surfaces for the time stated on their label to achieve reliable disinfection. We need to realize why we are disinfecting our surfaces. Here's poll number 2. You're going to need your label. I want you to look at the label on your disinfectant. What is the kill time on the label for TB? So we launched the poll. I'll give you about 30 seconds because you should have this. And you can mark 1 minute, 3 minutes, 5 minutes, 10 minutes, or you have no idea. You can't even find it on the label, which makes it difficult. Okay, I'm going to unlaunch the poll. And we're going to go ahead and move on because everybody's answer would be different. Transmission. How does transmission occur? Patients place their purses or phones on our countertops, or we place the patient's accessories on the countertops, which could be their cell phone, their wallets, their purses, what have you. We then use a pen and pass it on to the patient to sign their medical status form, and then we touch the chart. Then the chart is in the room with all the aerosols. The administrative team members now touch the chart, and that goes on, and cross-contamination is everywhere. The only good thing is that we all need to be paperless soon, by 2014. So we really need to, that'll help prevent some of the cross-contamination. But studies have proven that contamination of the environment has likely contributed to the spread of resistant pathogens such as MRSA and VRE and other community diseases. Now here's a slide of a common clinical area, and the surface touched during the day are covered with blue. We all realize that there are many more surfaces because I would also have marked the back of any of the clinical chairs. But after removing our barriers, we must evaluate the area to determine if it's contaminated. If not, replace with a new barrier. If so, we must disinfect and place new barriers. Barriers are single use only. We need to disinfect the entire room at the end of the day. Now, here is a slide that was a study on multi-drug resistant organisms. And we talked about them, that they're resistant to one or more of the antibiotics used to treat them. But these are multi-drug resistant organisms found on a keyboard in the mouse device. So we need to be aware that now that each operatory has computer technology, we must protect all of this from cross-contamination and from person to person. There are a variety of barriers that are available for protection of the keyboard and the mouse. And here is a couple. We have the old and the new. The old computer, which has the big tower and the keyboards. And then I just wanted to share with you the Dental Rat on the upper right, which is new, which is a hands-free periodontal probing that is infection control friendly. You use your foot. And the dentalrat.com has a video to show you how this works. And it works with a majority, if not most, of the dental software available to us. Clean Keys is on the bottom, and it is a flat keyboard. And you can just wipe the keyboard off with one of the wipes or wipe spray. And the mouse is on the keyboard, and it is flat. So it's really a great tool. So when evaluating your surface disinfectants and wipes, you need to compare their efficacy with the criteria for an ideal disinfectant. Each safety data sheet's available for each chemical product. You need to check the required PPE or personal protective equipment on your MSDS sheet so you know what is required. We don't know where cancer comes from. Our hands are like sponges. They absorb chemicals that we use. Protect yourself with the recommended PPE. And I must say that there are some products that don't have any PPE requirement, but OSHA requires gloves and PPE during your disinfection. So you need to check with both. Be sure you have your training on an annual basis so that you keep up with what's required, because things are changing quickly in infection control and OSHA. Washing hands prior to gloving and after gloving is recommended. Hands are like a sponge that can absorb chemicals. Clinical gloves have microscopic holes in them. Utility gloves provide more protection and don't have the microscopic holes because they're thicker. Utility gloves get washed and dried after each use and can be sterilized at least weekly. You can also disinfect your utility gloves. Utility gloves are not regulated by the FDA, so they can be washed or disinfected for reuse. Hufredi has a package of three pairs of gloves, and they fit. They're hand specific and they're sized gloves, and they really work. If you get the right size for your hand, they're not as clumsy, and they have to be specific gloves that you can use in dentistry. You cannot just go and purchase utility gloves at the grocery store. And not washing your hands can cause a transmitting of diseases. I did have a question on why clinical gloves have microscopic holes in them, because that's just the way they're made. They're not surgical gloves. Surgical gloves do not have microscopic holes in them, but they're much more costly. If you are using your 4x4 soaked in liquid disinfectant, it is not okay by the FDA. This is called off-label use. This is a medical device and it must be cleared by the EPA. So here's the concern. The 4x4s have been bleached. That's what makes them nice and wet. And the cotton within the 4x4. So what happens is you pour your liquid disinfectant, let's say in this container, and it can be deactivated by the chlorine or the bleach that's in the 4x4. So the interaction is not well known, but we know that it may not be working. So you may be wasting your time and money. If when you read your manufacturer's directions and it states you can use 4x4s in this manner, then go ahead. But there is not one manufacturer that I've read out there that you can use 4x4s in this capacity, in this situation. So it's not recommended. You cannot soak your 4x4s and use them. And really, if you're going to do this, that's using it at your own risk. And remember the story I had stated earlier about the transmission of hepatitis B from patient in the morning to patient in the afternoon, and they're pretty much looking at the contaminated surfaces. So what do you look for in a disinfectant? Well, this whole list, and there's not one ideal disinfectant. I hate to break it to you. But all facilities are different, and we need to read the labels and read the safety data sheet prior to purchasing. I recommend to make a list of what your team's needs are. Does anybody have allergies? Does anybody have sensitivities? Depends on the material on your chair. Is it leather? Is it vinyl? Is it cloth? But we need to remember that each disinfectant has value in different ways. There may be a trade-off between the kill time and the surface compatibility. Not one disinfectant fits each and every office setting. You need to purchase what works for your team and any allergies. And we have a lot of patients that are sensitive to certain things, especially perfume. We need to customize your selection of disinfectant. We need to make a list prior to purchasing. Now, we all need to clean first, just like we do with the dishes in the car and our fingernails. But I can hear you all now. Where are we going to find the time to clean first? Well, let's educate your team. Inform your doctor what is the standard of care. It can and needs to be done. Also, remember that friction is a key. Remove the visible dirt and organic material first, then disinfect. If your disinfectant does not say it's a cleaner, you will need to purchase a separate pre-cleaning product. Products with high amounts of alcohol may be less effective cleaners of organic material and are often sold with separate pre-cleaning products such as foaming cleaners. There is a two-step process commonly referred to as spray wipe spray, and it's recommended when a two-step product is employed. But first, the surface must be cleaned with a detergent. Once cleaned, the surface can be disinfected. Read the label to evaluate the product. Check if the product cleans and disinfects. There are many types of products out there. We have wipes, towelettes, maxi wipes, and these are products that are already impregnated with chemical. And then we have bottles with concentrated or diluted chemical liquid, which can be sprays. Aerosols are kind of on the out because we've had a lot of upper respiratory problems with the mist in the aerosols. Well, we now have squirt bottles that allow the chemical to be controlled on a paper towel or a 4x4. And remember, the less stuff on the counters, the better. And the less stuff means the less cleaning you have to do in between your patients, because anything on those counters have to be wiped down in between your patients if you have floss holders or anything like that. So let's talk about how to use the wipes. We've dismissed our patient up into the administrative office or the front desk, and we return to put on clean utility gloves that can be clipped under the sink on the cabinet door. Then we pull out the number of wipes that we need. And we need to remember that the user of these wipes or product is responsible for using them correctly. So we pulled out the number of wipes needed with the clean utility gloves. We closed the lid with the clean wipe. To prevent recontamination of this container, I see all sorts of things. You hold the container with one hand, pull with the other. Well, if you have clean gloves on, that's fine. But if you don't, that's not okay. So pull out as many wipes as you feel you're going to need, and you'll get a feel for that. Go ahead and clean your clinical equipment, your air water syringe, the slow suction, all the handles and everything you've touched. Clean the counters and the hand mirror and the x-ray equipment. Don't forget to wash your patient's eyewear with soap and water or use the disinfectant. And then let it drip dry while you're decontaminating your room. So we've cleaned all the counters and everything, and we're going to do it all again. The same surfaces, the same way. We need to disinfect the clean surfaces. The surfaces need to be wet for the entire length of kill time. So now we're going to discard the used wipes or towelettes. We need to remember these are not baby wipes. We do not want to contaminate water or food. We need to store in a dry location. We need to keep the cap closed. Do not reuse the towelette for anything. Do not flush in the toilet. And do not refill the container unless according to the manufacturer's directions, which we do have a couple manufacturers that are going green and are recycling their containers. And then at night, you can also flip over those containers so that the wipes get thoroughly soaked with your disinfectant. Now, sprays. If you can, avoid products with aerosols because the aerosol mists are easier for the worker to inhale. The propellants are usually flammable, and the nozzle can fail before all the product is dispensed. If that's the case, this product becomes a hazardous waste if it's not empty from the disinfectant. Inhalants can make you feel giddy and confused as if you were drunk. Longtime users get headaches, nosebleeds, and may suffer loss of hearing and sense of smell. Using household cleaning sprays and spray air fresheners just once a week can increase your risk of developing asthma. Whether or not the cleaning products are a direct cause of asthma or simply a trigger for people who have already have the disease is not well known. Other ingredients in cleaners may have low acute toxicity, but contribute to long-term health effects such as cancer or hormone disruption. Let me go back here. Spray wipe spray was recommended by the CDC in 1991, but that's also all we had. But many times we wiped everything down and then sprayed the heck out of the room with a product called Lysol, which in many practices stopped using because their teams were having upper respiratory problems, myself included. The CDC and the National Institute of Occupational Safety and Health demonstrated that there is a risk to healthcare workers for developing occupational asthma or exacerbating existing asthma from cleaner and disinfectant sprays. If you are using a spray wipe spray method, you need to hold the paper towel over the nozzle to prevent excess spray. Sterilization is the destruction of all forms of microbial life. Sterilization takes place with our instruments. Disinfection usually involves chemicals, heat, or ultraviolet light. The nature of chemical disinfection varies with the type of product used. Gloves are recommended for all chemicals. Chemicals are absorbed by the skin, but clinical gloves have microscopic holes in them. High-level disinfection are required to destroy all microorganisms, including bacterial spores, and must be proven to kill TB. This is usually used in the medical field with all the types of scopes that they use. So we'll leave that to medicine. Intermediate level disinfectant is commonly used and recommended in dentistry. There are a variety of products to choose from, and they're used regardless of the presence or absence of blood. But we need to clean, then disinfect. Low-level disinfectant cannot be used on a surface with visible blood contamination. Low-level disinfectant does not kill TB or bacterial spores. Low-level disinfectants are typically used to clean environmental surfaces. Disinfectants with alcohol tend to evaporate more quickly, sometimes before the full contact time. Alcohol denatures blood and other proteins, making it adhere to surfaces. Long-term use of disinfectants with alcohol may cause tubing and vinyls and plastic housing to crack and discolor. The Centers of Disease Control advise that alcohol-based disinfectants are not effective for environmental control of Clostridium difficile. Products with high amounts of alcohol may be less effective cleaners of organic material and are often sold with a separate pre-cleaning product, such as a foaming cleaner. Be sure to read your labels. Phenol-based products are registered as disinfectants and are the most commonly used. Required times are typically 10 minutes, although some phenol-based products have a 1-minute efficacy claim against HIV. Be aware that other microorganisms still require 10 minutes. These disinfectants maintain their activity in the presence of organic material. This class of compounds is used for decontamination of the hospital environment. Disinfectants that contain quats, which is quaternary ammonium compounds, require 10-minute contact time for most organisms, except HIV, which is typically 1 minute or less. Quats have evolved in now its 5th generation. Combining quats with alcohol has resulted in an even lower contact time, faster kill times, which enable a surface to be disinfected quickly. Quat products with higher alcohol content generally are tuberculocidal. Quats with lower concentration generally are not. Hyperchlorides are chlorine-based products and are fast-acting and economical intermediate-level surface disinfectants. They are an oxidizer, and it does have a strong odor and is corrosive to many metals. It is also destructive to fabric and may cause plastic chair covers to fade and crack. In an office that I worked at many years ago, the doctor was using sodium hypochlorite for rinsing of a root canal. And I wanted to share this story with you because I felt it was very important. Many people do not use protective eye protection for your patient. I have always done that because that was what was required in school, and I always felt, since I was getting calculus flying all over me and prophy paste, I felt that was in the best interest of the patient. But in this situation, the doctor was irrigating a root canal, and the syringe burst. And so that it exploded all over the patient, the dental assistant, and the doctor. The doctor was the only one wearing protective eyewear, the correct protective eyewear. So they got the patient over to the eye wash station and found that it was corroded shut and could not use it. So back then I was in a state that we could not practice as a hygienist without the presence of a dentist. So all my patients were canceled. So the truth of the story is that using protective eyewear for everybody is so valuable and so important. So these hypochlorides can do a lot of damage to somebody's eyes. So if you're using them, please be sure you're using protective eyewear. Hydrogen peroxide works very well as a disinfectant because of its ability to act as an antimicrobial agent. This means that it's able to quickly kill the bacteria. When hydrogen peroxide encounters bacteria, it quickly oxidizes some of the components of the outside of the bacteria. And this can not only be toxic to the bug, but can punch holes in its membrane that the bacteria use to protect and contain itself. As a result, the bacteria quickly die. But we still have to respect the TB kill time with every surface disinfectant. Now, the common misuses of products is we're not wearing the correct PPE, personal protective equipment. The kill times, are we really keeping the surfaces wet for the amount of kill time according to the manufacturer's directions? Are we killing all the pathogens? We can't assume anything. We need to read the label and go according to the manufacturer's directions and read the SDS sheet. This is why these manufacturers do all these testings. They do it for our protection. Now, effectiveness does depend on many factors. The larger the number of microbes, the more time germicide needs to destroy all of them. And the locations of the microbes must be considered. Physical and chemical factors also influence disinfectant procedures: temperature, pH, relative humidity, and water hardness. Barriers. Many of us use barriers, some do not. There are options. Many offices are going green, and I suggest that this topic be discussed as a team at your monthly meeting. It might be cost effective to barrier than to have team members with asthma and sensitivities out sick for a day or two. One day out can hurt production for the entire month. And there are a variety of different barriers that can be used. Here's your checklist. We want to check for health hazards on the SDS sheet, which is the MSDS sheet. We want to check for the emergency overviews, and we want to check for the eye rinsing. If we get something in our eye, what do? We need to flush it for 15 minutes. We want to find out what PPE, personal protective equipment, we need, and what gloves and what type of gloves we have to use or we can use. We need to remember that OSHA requires that we use gloves for disinfection. One of the most counterintuitive health threats is that of products that disinfect. Common sense tells us that killing household germs protects our health. However, disinfectants are pesticides, and the ingredients in pesticides often include carcinogens and endocrine disruptors. We need to read your labels about what chemical you are using. The safety data sheet will give you a lot of information, and research points to the toxic effects of not only active, but also some of the inactive ingredients in a product, and hazards that can affect the central nervous system, the reproductive system, and other vital bodily systems. We, as consumers, don't have the time or know where to go to find this important information about the products we use. And some of the information can be presented in highly scientific language that may be difficult to interpret. But there are a growing number of consumer-friendly resources that can help us sort out this information. And one of them is your MSDS sheet. You need to be aware to read that first. Now we have our last poll question. You need to look at your MSDS or SDS sheet on health concerns. We're going to launch the poll. I'll give you about 30 seconds and fill out which one works for your product. You didn't realize you had required PPE. You found hazardous health concerns. You've discovered what happens if the chemical gets on your skin. And wow, I need a respirator to work with this product. Okay, I'm going to unlaunch the poll, and there are going to be no results because everybody's going to be different. But I want you to be aware that OSHA has a new HAZCOM 2012 standard, and there's 3 major changes. So be sure you schedule your 2013 Infection Control and OSHA update. An OSHA training boot camp is available to come to your office and do your team training. I must tell you, we do have a lot of fun. OSHA boot camp, it can be a lot of fun. It's not me, a talking head. We do a lot of fun things and hands-on. So now here are some products that health hazards to disinfectants. And this should help you decide the product you want to work with in your office. But be aware that when viewing the warning or cautions about chemicals, such as O-phenylphenol, these warnings are based on really high concentrations of a product. So you need to be aware of what you're looking at. But check your SDS sheet when you're deciding what to purchase for your office. Now, as we worry about chemicals we use in the workplace, we need to be aware of formaldehyde, which is commonly known as a preservative that's in our fingernail polish. Many people do not know that it's also a germicide, a bactericidal, and a fungicide, among other functions. Formaldehyde is found in household cleaners and disinfectants. It's also known to be present in nail polish and other personal care products. Formaldehyde is a carcinogen. Protocols and procedures for cleaning the environment, surfaces, and equipment should be specific to the area being cleaned. The protocol should outline cleaning procedures, cleaning agents used, and schedule for cleaning. The whole team needs to be involved in your goal and your strategy for a clean facility. Written protocols help for this. We need a step-by-step 1, 2, 3 written protocol. This makes sure that everybody on the team is on the same page. What product you're using, how you're using it, when you're using it, and why you're using it. So now we have Wipe Down Wednesdays, and this is a reminder to help disinfect everything from the front desk to the back office. Look at the lower left, the germs for thought. The office toilet seat has 49 germs per square inch. The desktops have almost 21,000 germs per square inch. The phones are the worst, 25,000 germs per square inch. Remember, our cell phones carry staph, strep, E. coli. It's amazing what we find on our cell phones. They need to be disinfected on a daily basis. But desk phones and computer keyboards are key germ transfer points because people touch them so often. We cough, we sneeze, and we go back to what we're doing on the keyboard. Health experts say that simple office hygiene can reduce infection risks dramatically. We can reduce sick days and low production. This information was from the University of Arizona. It was sponsored by Clorox. So we have 4 questions to ask ourselves. Does the product clean well? Does it kill germs quickly? TB, how safe is it to use? And how safe is it for the environment? Now we're going to go ahead and highlight our sponsors' products, and we thank them again for sponsoring this wonderful webinar. Cavicide 1 is a new generation Cavicide. The first generation was Cavicide. It had 3-minute kill time. So you need to be sure that if you're getting Cavicide, what you're ordering, be sure you're ordering exactly what you want. Cavicide is multi-purpose. It kills 99.9% bacteria, viruses, and fungi. It has an extra large wipe, which is a 9x12. And it has a regular wipe, which is a 7x9 in a flat pack. They also sell a wall bracket for your container. It is a 1-step cleaner. It kills about 26 other organisms. And you can get more information on their website, and you can request a sample and tell them you're from the OSHA Training Bootcamp webinar. We now have Air Techniques, which is a newbie to the disinfectant line. And they kill non-envelope viruses, bacteria, and fungi within a minute. They have 7 by 9 inch towelettes, and they have a reusable container, like I mentioned earlier. This company is going green or recommending it. And they have 100 dry towelettes, and it's activated by adding liquid disinfectant to the container in the towelettes. Now, I do recommend that when you're adding this liquid disinfectant, you place the container in a sink, just so if you spill anything, you don't have a lot to clean up. Just a suggestion. Dissecting Ultra has different products and have different TB claims. So check your product and your claims prior to purchase. Sprays are different in TB than wipe and foam cleaners, so just be aware. So the spray TB claims can be a little bit longer, so you're going to have to check that. Dissecting is a new 5th generation of quats with alcohol, and this results in an even lower contact time, so it's a faster kill time, and it enables the surface to be disinfected quickly due to the presence of the alcohol. You need to check out your product labels, and the Dissecting spray is a 10-minute kill time where the wipe is a 1 minute. And there's a difference in the combination of chemicals to make that happen. And they have it kills over 17 organisms. Optum 33 TB is an oxidizer, and it breaks down to water and oxygen. It also has a reusable container, which is saving the environment from a variety of plastic containers. There are no safety warnings on this product, and they kill all bugs in 10 minutes. It's a one-step disinfectant, and it can be used on visibly clean surfaces. And Opticide 3 is the Opticide family of products from Biotrol, and it leads us into many different, into ready-to-use cleaners that provide a broad spectrum disinfectant. It's created especially for dental facilities. It's a fast-acting formula which will protect you and your patients and your operatory. And their motto is if you got 3 minutes, then you've got complete disinfection. And it's a product that's ready to go, and it has a 7 by 10 wipe, and it kills TB in 3 minutes. PD Sanicloth AF3 is effective against 44 microorganisms. It evaporates slowly. It's effective, I said that, 44 microorganisms, and it comes in a canister and individual packages. It has a large 6 by 6 3/4 towelette and a 7.5 by 15 towelette. Pro Spray Wipes are a water-based non-alcohol product. It's a broad-spectrum antimicrobial activity against Staphylococcus aureus, HIV, TB, and many other organisms. Pro Spray wipes and liquids are the same reliable formula. They are compatible for using separately or together, and they have a lemon scent. This is coming to a conclusion of our webinar tonight. We don't end yet. I want to thank our sponsors for sponsoring this webinar and supporting us. And our sponsors really do care about your health and your patient's health. They are available if you have any specific questions. Get on their website, and you can also request samples on their website. And many of these websites from these sponsors have videos on how to use a product or about their disinfectant. I want to thank all of you for joining OSHA Training Bootcamp webinar. Look look for another webinar in the fall of 2013. And I would like to ask you to go to Facebook and like us on Facebook. And possibly we can get more professionals, if everybody tells one or two professionals about OSHA Training Bootcamp webinars, we will be able to expand our attendees and reach more professionals to keep a lot more people safe. I want to go back to the OSAP organization. You can get the list of disinfectants on their website. If you can't find them, please let me know. I have the list. And I want to also talk about this past weekend. We've all been aware of the Tulsa, Oklahoma dentist with the lack of infection control procedures. He has lost everything he has ever worked for. So please be sure your team has in-office OSHA infection control training every 365 days. That is what's required per the bloodborne pathogen standard. OSHA Training Bootcamp has many ways to master procedures to keep the entire team on the same page. We do have a lot of fun. Don't forget to wait for your evaluation once you log off. And the evaluation and the CE is only for the active webinar. So look forward to more webinars in the future. And please thank our sponsors for sponsoring this webinar. Thank you so much for joining us and have a great evening. I look forward to you in the future.